Hey, good to see you again. Hopefully you enjoyed a quick little break. We're going to come back here with mini lecture 2 in Unit 4, where we're talking about the circulatory and respiratory systems, and we're going to focus on what's in Chapter 5, which is the respiratory system. Let's get to our content here. The respiratory tract, we're going to hit the basic components here, and of course we have to start in the nasal area, where we have the openings into the body, the primary way for air to be exchanged in and out of the body. Your nose is composed of a mucus-covered epithelial tissue, which is really serving as an air filter. And so whenever you have the sneezing response, that is the body's response to trying to expel any of those foreign materials, dirt, pathogens out of the nasal area. The epiglottis that resides at the back of your throat then is a fold that is responsible for covering the opening of the larynx during swallowing. So whenever you take a drink of water or you're eating a cheeseburger, you don't get that material into your lungs and aspirate. Continuing down then the respiratory tract, you have to then think of next the lower airways. So the trachea is the main tube that the air travels down your throat or down your animal's throat into and connects to the lungs. And there's two major bronchial tubes that make that connection, dividing them off into smaller and smaller and smaller airways and connecting to the bronchioles, and then all the way down to the alveoli. We'll see a diagram in the next slide. The lungs produce this substance called surfactant, and some of you may know what surfactants are used for. Generally, they're viscous in nature, and really here they're a mixture of fats and proteins, and they're meant to help kind of lubricate those alveoli and keep them from collapsing on themselves, so that whenever you are inhaling and exhaling, those are able to keep from just exhaling and not reinflating, so to speak. So it makes it much easier for them to work to kind of help keep them lubricated. Again, that diagram I was referring to, you see bronchioles coming down here, the bronchi, all the way down to these grape-like looking structures, the alveoli. Those are going to be coated in capillaries, lots of blood flow going there to exchange carbon dioxide and oxygen to help oxygenate the blood. So, of course, the lungs work and breathing is controlled. It's kind of a two-step process, of course, inspiration and expiration, taking air in versus taking air out. And the brain controls that normal respiration rate. And really, we don't even, it's of course an involuntary response. You're going to inhale and exhale normally at a normal rate without ever even really thinking about it, unless you choose to make your brain change your respiration rate. So typically, again, involuntary, but of course, you can adjust it should you need to. Now, of course, respiration rates are super important, just like measuring heart rate, measuring respiration rate in your animals, which all the normal respiration rates are listed here in the diagram to the right, are helpful in troubleshooting and diagnosing potential problems with your animals out on the farm. So we look at clinical significance. Anytime oxygen falls too low, blood takes on a really dark appearance whenever it fails to get oxygenated properly. And so sometimes if you look in certain tissue, that tissue can start to have a bluish hue to it. Lip tissue is often responsible for that. There's a condition called blue baby syndrome. If you have blood that fails to get oxygenated appropriately, the tissues in the lips will turn blue. Cyanosis is when you have then inadequate oxygen being delivered to those tissues. That's what you call that particular condition. You can also have things like pneumonia or diaphragmatic hernias. Here in this picture at the bottom, you see this is lung tissue that's clearly been infected terribly. Here's the trachea coming down, feeding that lung tissue. All of this makes it difficult for that lung tissue to expand and contract. You'll have scar tissue that forms there. And then this x-ray at the top, you see fluid that is accumulating in the lung, making difficult congestion for that animal to breathe successfully. So as we wrap up this mini lecture 2, a little bit of a short one here. So it's really important that we understand blood pathways and the opportunity to analyze potential problems in aiding in diagnostic of diseases. Number 2, again, you need to have a good sound knowledge of respiratory structures. That will also help us in diagnosing and treating disease that we may encounter, especially things that we're going to talk about later on. Circulatory and respiratory vital signs are something that you're going to need to be able to understand, troubleshoot, know, and repeat to a veterinarian potentially to help you with troubleshooting a problem. And then analyzing that respiration rate can really help indicate health challenges and status. You don't even necessarily need a lot of individual training. Lots of us can stand at the fence rail watching our cattle or watching your pigs and just watch respiration rate. And you can pretty easily sometimes pick out ones that are maybe suffering from some kind of respiratory challenge, as their respiration rates will be obviously quite higher than some of their peers in the pen. So those are a few things that are take-home messages for this particular unit. I'll look forward to interacting with you in the Canvas module that will go along with this section. Again, please feel free to ask questions at any time. I'll be glad to answer any of them that you have, help clarify your knowledge in this section. Thanks for tuning in again.